Hi nerds! Welcome back to another video. In this vast world of ever-changing medicine, we get access to advancements every day. Amazing, isn't it?
I mean, to learn something new, to work for a new innovation every day, not knowing how, where, and what you learn may be useful tomorrow to actually save so many lives.
This is a new series on behalf of Nerds Anatomy called Clinical Diaries, where we will share our candid hospital experiences, the highs,
The lows,
and everything in between. The resources that really helped us and we hope would help you too.
Do you mind coming in a Northern Art video?
Step 1, wake up early, gonna rise with the sun. Step 2, get some good, some food in you. Step 3, think real hard about what you wanna be. Step 4, everybody just do your thing.
Wake up, today's gonna be a good day. 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 Set your affirmations,
Hi people, it's medicine. It was a good posting, but it was hectic and Invictus ruined stuff. So yeah, that's Zoe sir. इनका सपना ये medicine branch
one thought, have some concentration. And if I make a mistake, it's called education. I try to do this every day. Call it
So in my 6th semester, we had 1 month of medicine postings, and I think I could do this posting for the entirety of the year. Even I think saying this might sound like an understatement to me. Every day we learned examination of a new system, we discussed a new pathophysiology of disease, and after the theory class, our unit would be allotted patients and we had to take case history and present the case. The thrill, not literally but figuratively, of solving the case step by step, using every fact and every lab test as a clue to finally unravel what your patient has been going through, has been the high of medicine for me. So now I'll be talking about what are the things that I use for my medicine posting, and first off I'll be talking about the Clinical Handbook, McLeod's versus Hutchinson. So I purchased both of them. Hutchinson has better explanation for clinical tests, especially the physiological aspects behind the CNS examinations that has been explained beautifully in this video, which will be really helpful for you at the time of revising your concepts. However, McLeod has things more on a differential basis. For example, give me 10 causes of clubbing, or give me 10 causes of dyspnea or massive splenomegaly. So I would say McLeod's is more oriented towards an exam approach wherein you can easily learn the differentials, as most of the content has been summarized in tables and figures. I have learned through this posting that patients are the living pages of your textbook. Of course, no theory can beat experience, so interact with more and more patients to develop clinical skills. Over the course of this posting, I have seen my Kannada language progress from literally a 0 to probably a 4 or 5. Bonus tip, you can also use these apps called Prognosis or Clinical Sense. It really helps you to get through clinics because it provides you a simulated environment of a clinic, and it will really help you in recognizing the symptoms and advising treatment. Do check it out, it's very helpful. The next thing that I used for my clinical postings was the stethoscope, and I would advise all second and third years to probably not invest as much in buying the stethoscope, but to orient yourself at this point with various heart sounds and lung sounds. The third thing that I always had with me was my case sheet record book, so I noted down all my cases. So here is all that I've learned from my medicine posting in a nutshell. Number 1. History taking. History taking is actually the crux of patient diagnosis. It's repeated on the first day of every posting, and to be very honest, this is something that I can now wake up from sleep and do. If you still don't know how to take history, then I really believe your year has been wasted. Second, medicine typically has a lot of signs, a lot of triads to remember, a lot of maneuvers that you can perform on the patient, and I believe examining the patient and implicating these on them will help you retain them for a longer time. Number 3, speaker. I know this sounds weird and it might feel awkward while presenting case to your professor, but please make mistakes and keep learning. As many cases as you present, so will you gain confidence. Number 4, try correlating your medicine and surgical skills to what you've learned in pathology and pharmacology. You will find that a lot of the medications for a lot of the diseases have been correlated with your pathology studies, and this will just help you retain them for a longer time. Lastly, learn the basics of ethics of patient care. Learn to interact with your patients. Stop feeling awkward when you've been asked to examine them. Please make sure you have a female bystander if you're examining a female patient. And in case a patient refuses examination, as happened to me a lot of times, please respect the authority of the patient and always preserve the modesty of a patient. These are just very small basic points that are very important. I really hope you guys understood that the crux of postings is to orient you to patients and bedside medicine, and also realize that this is the side of medicine where you apply all that you read.
Make the most of this beautiful art we call medicine, and we'll see you in the next video. Love always, the Nerd's Anatomy.